Okay, so first you wrote the crop report in 2005 or 6, followed by lost taxes in 2007. Tell us how that impacted your life and how it impacted the world of cannabis before and after.
Well, I'm not so sure it had much of an impact on my life. As far as the overall public debate about marijuana laws and so forth, the last crop report really helped establish that marijuana cultivation was a huge economic entity in the United States, and for the first time we actually had government estimates of production that were incredibly large. It was 10,000 metric tons, and the U.S. State Department had been using that figure for about 5 years prior to me putting in a report and basically saying, look, there's other evidence that the crop is that big, and if it's that big, then it's worth this much. And I believe we were talking $35–40 billion of value, because you have a commodity that is selling for $3,000 to $4,000 a pound retail. And it's no surprise that, for example, marijuana was so much more valuable than corn because, okay, you have a single marijuana plant, and let's say you get a half pound of marijuana off the plant. That's a lot of pot off a plant. But you have a plant that might produce a couple $1,000s worth of marijuana compared to a corn plant. Now, corn is a fantastic crop. It's got multiple uses. It's a food stock. It's a feed stock. But you need an acre of corn to get $400 or $500. You can arguably get $400 or $500 out of a single marijuana plant or more. So the crop report was just a successful exercise in getting the media and the public and people discussing the pot issue to recognize just how big it was as an economic phenomenon. And the government can't have it both ways. They can't say, oh, well, it's pot everywhere and there's people growing it and smuggling it, do something about it, and then turn around and say, oh, it's not worth very much. Well, no, it's worth a lot. And every time they bust people and say, oh, these plants are worth several $1,000s, it just encourages more people to get involved in the market. Now, the follow-up report on lost taxes, that was a little bit more esoteric.
Hold on 1 second.
Yeah.
Tell us how much attention you got from the crop report. You were president of Normal when you did?
No, this was as a independent.
Okay.
I originally did the crop report when working for Normal, but the last one was done as just an independent writer, consultant with me. And I got a lot of help from the Marijuana Policy Project, who handled the press on that. And it got picked up by the Los Angeles Times, which then caused pretty much every paper in the U.S. to run a story about it. It also got picked up by the Australian Broadcasting Company, by the BBC, so it got a lot of international attention. I got press calls from the Australian Broadcasting Company. I did a radio interview with a radio station in Ireland. I saw stories that were published in India and Pakistan and in South America and Colombia and Mexico. It truly got international coverage. Part of this was because it was originally broke by the Los Angeles Times, and part of it was because the source material was government reports. It wasn't just some guy, with a calculator coming up with some models and doing a lot of what if. This is actually bona fide government reports as source material. So it got international attention. And it just established in the public mind and imagination and debate that marijuana was worth tens of billions of dollars. Now the next report, Lost Taxes, that didn't get much attention at all.
What inspired you to write that?
Well, it was just sort of the next logical step in terms of my approach to the tax issue was, well, we can't estimate the tax value of pot when legal. There's too many things we don't know. We don't know consumption is going to go up or down. We don't know the market. We don't know the economics. But we do know now the taxes we lose by it being illegal. There's all that money being spent on marijuana. There's not a sales tax. There's not a payroll tax. There's not a corporate profits tax. All that money is outside of the normal flow of economic activity. Also, I'd gotten my PhD in public policy. I'd specialized in regional economic development. I knew a little bit more about the economy. I knew a little bit more about finance. I knew a little bit more about taxing. And there's a marvelous number that the federal government maintains. It's put out by the Office of Management and Budget, and it says that this percent of the gross domestic product ends up in the hands of government. And I don't know, it's 27, 28% of our GDP ends up in the hands of the government, one way or another. Again, payroll tax, income tax.
Yes, that's accepted by economists.
Sales tax, whatever. And in fact, they argue that, okay, it's the highest level ever, or it's come down, it's gone up. So you can basically take any amount of illegal activity and say that, well, 27% of that is lost taxes. And so that's what I did. Is I took the best estimate I could get I took all the data that was published about marijuana consumption, about marijuana supply, about marijuana usage, and I applied conventional modeling techniques that I've been taught by a very reputable university and training people to analyze public policy. And there's a modeling approach where you say, look, you know, I don't know the exact answer here, but I know the territory. I know that if you can make this into a two-dimensional model, that, you know, it's not more than this, it's not less than that. The true answer is somewhere inside these boundaries. And you can create those boundaries with marijuana by how many users, how much marijuana is grown, what are the range of prices, and you can say, well, you know, the true estimate of how much is used, what it's worth, it's inside this area. Again, it's sort of a spatial presentation.
But you were more creative than a conventional economist was, because you went to sources they wouldn't have gone to, like High Times marketing, the market values.
Yeah, for example, the market
and then
values.
you averaged 4 different sources, which a conventional economist wouldn't do. So you were more creative. You put a little more creativity into it.
Well, I'm not sure if I was more creative, because again, this is a conventional modeling technique that I was taught as part of a very conventional program in public policy and economic analysis. I think the fact that I was a little bit more aware of other data sources that other people weren't prone to think of. I mean, I've written for High Times for decades, so I'm aware that they have people sending them in quotes every month about what marijuana is selling for in different parts of the country. I'd also been following government reports. I think everyone is sort of aware that police go out and buy drugs on the illegal market. And what people don't understand is that the cops make records of what they pay. What they pay for pot, what they pay for cocaine, what they pay for heroin, and that all these prices from police departments around the country all get sent to the DEA or the Office of National Drug Control Policy. So we have a federal data set on drug prices. So I took prices from published DEA reports, prices published in newspaper accounts, prices reported to High Times, prices reported in these government reports and these government data sets. And again, you can do this spatially in the sense of there's a range of prices, and we get highs and lows, and we get prices that are more consistent with each other, and you get some boundaries. And so I basically took all this information and kind of plugged it together and said, well, you know, it's lower than this and higher than that, and I came up with numbers that I thought were in the middle of all these different prices. And again, it's a conventional modeling technique. In fact, conceptually, it's the same thing we do in something called regression analysis, something called least squares regression, but that's a little far afield from what we're talking about here. But again, the idea is you get all the data you can possibly find on a topic, and you reconcile it, and you come up with a model that's consistent with all the data, that is not too off from all these different estimations. And that's how I got the figure that the marijuana market at retail is over $100 billion a year market,
Which is about 10 times more than some conventional economists were saying at the time. Why do you feel you weren't more embraced by the conventional economist community after discovering?
Well, probably because I didn't publish this in an academic journal. It was just a privately issued report publicized by a marijuana advocacy group, Marijuana Policy Project. We got some good coverage in Forbes magazine, and it was a very reputable business journal. And the numbers there do pop up in the debate over time. Activists have gotten their hands on it and provided it to legislators. Legislators have found it on their own doing various searches. So the number's out there and it's part of the debate. The earlier crop report tends to get cited more often these days. But, you know, like I said, I think I get more attention if I put it into an academic journal. I probably should have, and I probably should in the future. But also, people who study this issue academically, who don't have first-hand knowledge and exposure to marijuana users, to marijuana markets, they don't have even good ethnographic exposure, that is observational exposure of this culture, they're a bit detached and they only get a partial view of the whole phenomenon. There are a lot of academic experts who are quite reputable, quite credible, extremely bright people who are extremely critical of prohibition, by the way, are very critical of the government reports. And for example, some of my works have been criticized, perhaps with some legitimacy, for relying on government reports. They basically say, look, the government's putting out a lot of, to be polite, bogus material, and so to extrapolate from that bogus material, the government's exaggerating the size of the market, so this critique goes, and so, you know, any analysis based on their exaggerations is also a bit inflated. I understand that, and basically it's going to take better data from a more legal, from a more open market to get more accurate, dependable, and more trustworthy information.
Kind of like how the Colorado Medical Marijuana Enforcement Division statistics, they've tracked the amount of workers, the amount of taxes they've collected, the total sales of all the medical marijuana dispensaries in Colorado, which there are 700. Is there some good hope for mining that data set?
Absolutely. California, Colorado with the medical markets, the other dispensary-based markets in the medical area, the forthcoming regulated, more open markets in Washington and Colorado, the so-called recreational markets. We're going to get more data about consumption, how much marijuana people consume, what they're willing to pay for it, how frequently they use marijuana. It's going to take some time, but
the fact that
they'll be more confident.
The fact that sales tax is going to be paid means a lot more records are going to be kept.
Yes.
So that becomes facts. Let me ask you this, John. Your reports were released in 2006 and 2007, before the economic collapse. I'm wondering why people were more motivated to return to them or to legalize fully now that the nation has descended and the middle class has been subtracted so heavily. Why is it too much of a political hot potato for any politician to touch it? Because it seems like legalizing marijuana would be a fabulous way to help to jumpstart the economy.
Well, this is not viewed as an economic question by most of the public. In fact, I would argue that most adults really don't care that much about marijuana's legal status. They don't really care about legalization. Their issue is they don't want teenagers to have access to it. They don't want their kids to smoke pot. They don't want people selling marijuana to their kids. And they think prohibition, with all its faults, is the best way to deal with that. They're not happy about sending people to jail for pot, but they think that an illegal market reduces consumption. Now, I would argue the opposite of that. I'd say the illegal market inflates prices. High prices encourages kids to sell pot to each other. There's survey data buried away in the national surveys that we have some 600, 700,000 teenagers every year selling drugs. Kids sell pot to each other to make a profit. marijuana were legal, they'd have less access, there'd be less profit, there'd be less teenage availability. But again, the public doesn't see this as an economic issue. I mean, they know that it's valuable. They know there's a lot of money being passed around. They know that people sell pot for money. But basically, people have much more important things in their life. The security of their job, the education of their children, the events in their local community, the state of their schools, the state of their local roads, health insurance. There's all kinds of issues that dominate people's attention. This is not very important to a lot of people. Now, maybe it should be, maybe it could be, maybe it will be.
Even with the incredible high unemployment rates in places like Detroit?
They view this as a minor issue in that context. Now, we can speculate and analyze and estimate jobs from marijuana, even insofar as the whole issue of hemp, which is actually related but a totally different economic phenomena with incredible potential for jobs and economic development. But people see the marijuana issue as a drug abuse issue, and they see it as a teenage availability issue, and I think that's not going to change until advocates of marijuana reform address those concerns and directly address the issue of whether teenagers have more or less access in a legal market.
Why hasn't a marijuana messiah emerged like Gandhi or Martin Luther King to lead the movement?
Well, I don't know if putting a face on the movement is necessarily a productive way to go. I don't see this as a charismatic issue.
You don't think it would help to have a mediagenic personality rallying the troops, so to speak?
No, I don't. There's a lot of people in the marijuana reform movement who view it as a civil rights struggle, and that's sort of natural for anything involving political organizing. But it's
you're talking about seeing it as herbal rights.
A lot of marijuana users see it that way, but the faces are the people who get arrested. The faces are the people who need it for medical reasons and don't have access to it. The faces are the patients whose lives or quality of life is prolonged by it. There's a recent news story about a family whose child suffers horrendous seizures, and they found that marijuana helps stop those seizures. Those are the faces that are important here. Anytime this issue gets humanized, okay, abstract question, should some kid go to jail for smoking pot or selling pot? Sure. Should some kid go to jail when it's your nephew? Oh no, that's different. He's a good kid. Or, she's a good kid, she just hung out with the wrong crowd. Whenever it's humanized into individual people, the public gets a lot more tolerant and understanding and supportive of reform or mercy or discretionary sentencing or what have you. So the faces here are the people affected by stuff, not someone trying to make themselves the face of the movement. I mean, I think that may have been effective in the early days when Keith Stroup, for example, started NORML, and some would call him the prime minister of pot, and it made for good copy. But I don't think that's really the model that we have today. And if you look at the four prominent reform organizations today, NORML, the Marijuana Policy Project, the Drug Policy Foundation, and Americans for Safe Access. To some extent, Ethan Nadelman gets a lot of good press and gets out there as a vocal and well-known advocate for reform. Steph Shearer also does a lot of good press work, but you really don't see, for example, NORML and MPP stressing that individual personality as the public face of the movement. They do more work with organizing people, providing resources, and in fact, employing professional communications professionals to represent the organization. Pretty much like most modern advocacy groups, it's not that mystique of the charismatic leader so much as it is an institution, building an organization, creating an infrastructure, providing resources, providing training.
Why do they have such difficulty crossing state lines in activism? For example, Normal, we have like Normal, Ohio. We have Normal Women's of Ohio. We have Northeast Ohio women.
Well,
why is it so splintered? I compare it to civil rights when it was unified. Will it ever unify? Will there ever be a huge marijuana march on Washington? Can we expect anything like we've seen in the past from huge protest movements, or is that not going to happen?
I can't speak to that. I'm not involved with Normal these days. I'm not privy to their strategy and the issues that affect their activities and so forth. Now, when I was with Normal in the 1980s, I helped design their activist program, and we went. It was a big change then from the national model to a local model, and it basically came down to this is going to have to be a grassroots struggle, and you have to organize from the local level up, and that state governments were the best areas to change local laws. I mean, look, we're looking at 800,000 marijuana arrests a year. They're made by local police departments. They're made based on the authority of state laws, and they're made by state police and county police and city police forces. It's not the DEA who's going out and busting 800,000 people a year. It's local police. So in that context, working in the individual states makes a lot of sense. And in some respects, because we have federalism in this country, seeing reform happen at the local level encourages other states to reform their laws, and it's sort of a domino effect. So, for example, we've seen medical marijuana domino across several states. I think we're up to 18 now. We have 2 states, Colorado and Washington.
Good thing?
Yes, it's a very good thing. And
what about for the people who don't have diseases that qualify? How good is it for them?
It's not good for them, but it's a matter of progress. Colorado and Washington, okay, they have legal regimens now. If those go well, other states are going to get in on the act, and over time, that builds political support for federal change and to bring the federal government along.
So you believe in the tipping point theory?
I hate that phrase, tipping point, and I know about the tipping point thing in terms of social science theory, and I don't go for that at all. I go on a broader model of the diffusion of innovation. You see other people using something, you go, hey, I can use that too. You see what the benefits are, you have some choices. These are esoteric issues. The bottom line is, it's not acceptable that someone in Montana can use marijuana and someone in Alabama can't. It's not acceptable to have a legal over-the-counter market in California and an illicit living room market in Florida. There has to be a national set of regulations with a national market that pretty much covers everybody in the country. And until then, people who want to change these laws have a lot of work to do.
Is there a single friend in the Obama administration that believes that?
Every politician from California and Colorado and New York and all these medical marijuana states, you'd be surprised how much the state law changes affects the national politicians.
Okay.
So, for example, the Obama administration draws personnel from these areas, both in their political operation and also, as direct employees. When they have allies in Congress for other issues, they need the congressional delegation from California. Well, these people are all now heavily invested in marijuana reform. A lot of odd things are happening politically. Now, let's leave the Obama administration for a moment. Rand Paul and Mitch McConnell, 2 conservative Republican senators from Kentucky, are now totally behind industrial hemp and have been sponsoring and pushing legislation in the Congress to allow research at federal agricultural research facilities on industrial hemp. They're behind this in a big way, and I'm in touch with the people who are pushing for hemp in the Congress and elsewhere, and they work closely with the staffs of Rand Paul and Mitch McConnell. Now, there are other issues where these guys have different positions, but when it comes to hemp, these guys have very good, sound positions because it would benefit Kentucky.
Let me cite you an issue. I don't know if you're aware of it because everyone sees Colorado as a big, incredibly pro-marijuana state. Do you know that any city or any county can opt out of either medical or recreational marijuana in Colorado?
I'm not familiar with the.
Would it surprise you if I told you that 2/3 of the counties have banned marijuana in Colorado?
No, it wouldn't surprise me at all.
So the big problem is, let's say that you had already, now that there's recreational marijuana, which includes provisions for growing, 40 acres of hemp. Let's say you bought a 40-acre farm, you spent a couple $100,000, you bought yourself some nice tractors, you bought some fertilizer, you paid for the whole thing. The harvest moon's hanging, and now your county just opted out. That's a big issue.
It is a big issue. Capitalism has risks, and people need to be aware of those risks before they get into any market. I don't care whether it's marijuana or something else. And the marijuana market is complicated. It's controversial. There is a clash between state and federal laws. And by the way, I mean, San Diego tried to opt out of California's medical marijuana laws for the last decade. They have ultimately failed in that based on the nuances and precedents of California state law, but none of these experiments in the states are going to be safe and secure, or long-lasting, or perfected, if you will, if anything can be perfected. We need federal regulation. We need a federal solution. We need a national solution to this. But this innovation at the state level, as imperfect as it is, and as fraught with peril as it is, and as unsatisfying as it is for those left out, it's still progress, and it brings us along, and this issue has more promise today than at any time in the last 30, 40 years. And, we just have to keep working with it.
Fair enough.